Our thanks to Anne Marie Berger for that. I'm here with Dr. Ken Haller, Associate Professor of Pediatrics at SLU Medical School. We're talking health. Let's start with what we just saw on the screen.
Right.
I believe it was fewer than 5 hours the average medical student receives in training as it regards the issues to the LGBT community.
Right. Up until now, there really hasn't been that kind of commitment to LGBT equality and to teaching about LGBT issues in medical schools. If it happened, it was because there was a committed faculty member there who was usually pushing for it. I am that person at SLU Medical School, and that's true at a lot of other medical schools. Now, one of the things that's been really positive is that the LCME, the Liaison Committee on Medical Education, and the American Association of Medical Colleges is now saying that this sort of training really is important, but of course it always takes years for that to finally come into effect.
So what's missing when they don't get that training?
Well, the thing is, I think it's just an awareness that for physicians that the patient sitting in front of you might be lesbian, gay, bisexual, and transgendered. That is not something that is just obvious or apparent. And the thing is that there are real disparities that people in the LGBT community have compared to the general population. And so if physicians don't know to ask those questions, people are not going to answer, and those issues can't be addressed. One of the issues that comes up time after time for LGBT persons when there are questions about their health care is that the physician, it doesn't even occur to the physician to ask questions about this, and questions are asked in such a way that presumes that the person is heterosexual. So for example, a woman who's coming in for her well woman exam might be asked if she's in an intimate relationship. If she says yes, then the physician might say, are you using condoms? And the woman might say no, and then she gets a lecture on safe sex. And of course, she's a lesbian, so condoms really aren't necessary. But she gets the message, this isn't even something that's on this person's radar. If they're asking questions like this, rather than saying, are you in an intimate relationship? Is that with someone of the opposite sex, the same sex? Just finding out really about people. And when physicians don't do that, again, people get the message that this is just not important and they don't want to be asked about it.
So do they not come back, or how does that trickle down to the rest of their health?
What happens is it creates a barrier. People say, is this problem I'm having even worth going to a doctor about? Because I just don't want to put up with that. And so if their healthcare provider is not someone who they feel is going to really be present for them, really listen to them, and really address the facts of their life, they're going to back off. They're just going to wait until it's absolutely necessary to get health care and then end up in an emergency situation.
So how do they find a doctor? I think we saw in Anne Marie's piece, there are 15 in the entire state that have...
Right. Yeah, the Gay and Lesbian Medical Association, which is a national professional organization of LGBTQ professionals, does have a provider list, and you can go to glma.org and go there and put in your zip code and what you're looking for, but there aren't a whole lot of physicians and other healthcare providers who've signed up to be on that registry. That's something that I'm a member of GLMA and a former president. That's something that we're really encouraging any healthcare provider to do if you are willing and eager to serve the LGBT population. One of the best ways, frankly, is just to talk to your friends. That's one of the things I ask people all the time is, who's your child's pediatrician? Not that I need the business, but it's more just about finding out.
You hand them a card.
Yeah, hand them a card. No, just finding out who they think is a good pediatrician. This is how people find their physicians, and I tell people in the LGBT community the same thing. In fact, a lot of people will ask me that question, and I'll direct them to people I know. But it really is important to find out, who's doing that job, and sometimes they're doing it more publicly, sometimes more just on a referral basis.
Do you see disparities in the LGBT community versus the rest of the population?
Yeah, certainly. And a lot of that really has to do with the fact that people who are LGBT have often spent their entire life feeling isolated. One of the unique aspects about being lesbian, gay, bisexual, or transgender is you often don't grow up around people who are like you, at least not as far as you know. So you tend to hold things in, you tend to feel isolated. That can lead to depression, and that can lead to issues around substance use, cigarette smoking, things like that. And these issues tend to be found at higher rates in the LGBT community. There are also other particular syndromes that people have based on their lives. For example, lesbians tend to have higher rates of certain types of cancers, not because they're lesbian, but because they're less likely to have had children or to have breastfed, and those are protective factors for things like cervical cancer and for breast cancer. But the thing is, if a healthcare provider doesn't know this and isn't open to asking that question, then that information is not going to come out and the appropriate screening is not going to be done based on who this person is sitting in front of them.